Hi, Dr. James Boone at La Hacienda Treatment Center, internal medicine doc and addiction medicine doc. I've been working here full-time for the past 17 years and want to talk about a group of chemicals that a lot of people don't think about as having abuse potential. And that would be just medications that are available over the counter, or what we call OTC. So the over-the-counter drugs, we should not think of those simply as being safe just because they don't require a prescription. Those drugs have potential for abuse. Now, for me, there's really just a few medications in that family that I see as really problematic. Over the past number of years, one of the more common over-the-counter drugs that we see that come into treatment is the drug dextromethorphan. So dextromethorphan is also, you might see just the initials for that of DXM or DM. So commonly available in it's one of the cough suppressants. So Robitussin DM. There is a cough and cold medicine called Coricidin, cough and cold, but there are multiple different products that contain dextromethorphan as the primary cough suppressant. So dextromethorphan was a drug that has opiate-like effects, but it's not well absorbed to cross over what we call the blood-brain barrier. So when taken as directed, in doses as directed, it really does not have any opioid type effect. There's no euphoria, you don't feel that chemical. And so a lot of you who might be listening might be thinking, well, I've taken Robitussin DM multiple times, and I've never felt anything with that. But unfortunately, is that somebody that wants to take this in incredibly large doses, and I'm talking about 15, 20, 30 times the recommended dose. So if you're taking 1 tablespoon, they might be taking 30 tablespoons, drinking 2 bottles of Robitussin DM. When that drug is taken in those doses, it will cross the blood-brain barrier, and that drug actually becomes opioid-like, but also what we call a dissociative. That's a weird word, but basically just think about where your brain and sensations are no longer associated. And so it can give you this almost hallucinogenic type, LSD type experience, or there's another anesthetic called ketamine, a ketamine type experience, where people can have both this euphoria and this separation of normal sensations. That drug also was more commonly abused in the adolescent population, but again, now with drug testing widely being done at different places of employment, we've started to see more and more adults that start to abuse dextromethorphan. Something you can pick up at any pharmacy or even convenience store. But again, when taken in large amounts, can have this very profound effect from a neuropsychological standpoint. Sadly, at very high doses, it can be fatal. There are deaths reported with dextromethorphan. Fortunately, those are very rare, but when used in combination with alcohol or with other substances, there can be additive effects. You want to look if you see changes in behavior, you see spending habits, commonly going to the pharmacy. You might find empty bottles of Robitussin. You might find empty bottles of cold medications in the trash can. There's several different names for that because Robitussin is one of the more common drugs that's available with Robitussin DM. One of the terminologies is robo-tripping, where people go on this drug-related trip. One of the different formulations is a little red capsule-like tablet that looks sort of like a Skittle. And if you hear an adolescent talking about a Skittle party or skittling, maybe using some of that terminology, really what they're talking about is the use of dextromethorphan. It's commonly a drug then that also takes people into more dangerous drugs and into other opioids and opioid classes of medications. So dextromethorphan, probably what I see most commonly on over-the-counter drug abuse. Second drug that is commonly abused and not recognized by the general population would be Imodium. So the anti-diarrhea drug Imodium, or loperamide, it's actually a cousin of an opioid drug, but at the doses that it's prescribed, again, it doesn't cross into the brain itself, and it just worked on receptors in the intestine to decrease diarrhea. And so it has a real role just in regular medical care. But when taken at high doses, again, at doses of 15, 20, 30, 50 times the greater prescribed dose, that drug can cross the blood-brain barrier. There are multiple drug user websites that unfortunately drug users go to and look up different chemicals and how may they be able to abuse those chemicals. And there's multiple websites that talk about the use of loperamide or Imodium to try to get an opioid-like effect. It's even been considered, quote unquote, the poor man's methadone, a drug that sometimes drug users will try to use to try to come off of heroin or hydrocodone or oxycodone or fentanyl to try to maybe minimize some of those withdrawal effects. But unfortunately, when they take it at those very large doses, they're still putting themselves at risk. And again, there have even been cases of fatalities because of its opioid-like effect or euphoric effect. So that family of medicines, loperamide or Imodium, to look at those. The second group that would be relatively commonly abused, and I've admitted multiple patients over the years, would be some of the sedating antihistamines, specifically diphenhydramine, which is the active ingredient in Benadryl or Tylenol PM, almost any of the quote-unquote PM products, Advil PM. So the sedating antihistamine diphenhydramine, when that's taken at very large doses, it can have sort of an opposite effect. For some people, it can be very sedating if they're trying to initially sleep, but some people get a paradoxical response, can be energized, get this euphoric response, but again has potential catastrophic effects, specifically with cardiac toxicity and heart rhythm disturbances. I've seen some profoundly abnormal electrocardiograms in my career coming from Benadryl. So commonly thought of as such a benign, safe option, but again, when you supersede those normal therapeutic doses, it becomes a drug that has some real abuse potential and even danger potential. And so over the years, I've had a number of patients whose primary drug of choice is actually Benadryl or diphenhydramine. Another cousin to that is a motion sickness medication that's one of the ingredients commonly sold over the counter in Dramamine. And it's got another name that sounds kind of like diphenhydramine. That drug also has both the sedating but also paradoxical energizing response and also has cardiac toxicities. So think about those motion sickness drugs that are available over the counter. Now, there's some other drugs that we'll see people abuse from an over-the-counter standpoint. Pseudoephedrine is one of the cold medications or decongestants. That now has been taken to what we call, instead of over-the-counter, it's behind-the-counter. That behind-the-counter was primarily because it was used to make methamphetamine. So people were buying the pseudoephedrine tablets in large volumes, and then people who were manufacturing methamphetamine used the pseudoephedrine compounds. So now that it's behind the counter, that's a little less of a concern, but still people can buy that behind the counter, and it has this stimulating, energizing effect. So specifically in my patients that like the stimulants, my cocaine users, my methamphetamine users, they might look at just trying to get the stimulated effect from that. Can have profound effects on sleep quality, sleep disorders, also some different with weight loss, fidgety, agitation, rapid heart rate, blood pressure elevations, some real dangers with the stimulant. Lastly would just be caffeine. And for me, as a coffee connoisseur and coffee drinker, I'm not talking about just simply a good cup of coffee or a good cup of tea. I'm talking about hypercaffeinated products. So when people are drinking large quantities of the hypercaffeinated beverages or buying caffeine pills to try to take to stay awake. And people can become very psychologically dependent, not this true sort of chemical dependence that we see with other drug use. There can be a physical dependence, so that people who are using large amounts of caffeine might have headache or fatigue when they come off of those. But my main concern is where they're trying to just take excessive amounts, potentially to counteract the effect of another sedating medication. That then brings into play risks again of heart rhythm abnormalities, blood pressure elevations. So those are the primary drugs of abuse in the over-the-counter family, but just with specific attention to dextromethorphan as one of the more dangerous of those. If you have a family member and you've seen changes in personality, you're seeing these behavior changes, you've done drug screens on them potentially at home, their drug screens are negative, there's concern about personality changes, behavior changes, that may be something you would want to explore, something that we deal with here at La Hacienda on a regular basis. We'd be happy to help you explore different treatment options. Thanks for your time.